Rethinking Fabry, mild disease, clarifying common questions and misconceptions. We spoke with leading doctors and healthcare professionals from different specialties about what it means to have mild Fabry disease and what complications can arise later, even if your symptoms are under control right now. What does it mean to say Fabry disease is progressive?
Progressive disease means that it's cumulative over time. It's sort of like dropping pebbles into a pond. Those numbers of stones in your pool continue to grow and they never go away.
With Fabry disease, you can have kidney damage, heart damage, brain damage. And once you have damage in those areas, it will get more and more severe over time.
Is it okay to stop or delay my treatment if I'm not experiencing symptoms?
There are a lot of silent things that can happen in Fabry disease. You can have very advanced damage without actually experiencing any symptoms. Fabry disease is a condition that you're born with and it will always be there.
The reality is that many people, even without symptoms, may need treatment. Just because you feel great now doesn't mean you're going to feel great in 30 years.
There are patients that we have had that have been on therapy that felt like it wasn't making any difference. And I'll tell you, out of those, some people come back and say, I was wrong. I had no idea how well I was doing until I came off of therapy.
I've heard that women are only carriers of Fabry disease. Does that mean they can't experience symptoms?
No, that's actually a big misconception. We used to think that a person who had Fabry disease that was female was just a carrier for the condition because they have two X chromosomes. And the gene that's associated with Fabry disease is actually on the X chromosome. We used to think having two copies protected that person. Now we know that females can manifest symptoms.
The majority of women will develop symptoms and will eventually have health problems related to Fabry disease. So I would recommend that every woman who may have Fabry disease be assessed, and if she has any symptoms or any signs of organ damage related to Fabry disease, then she should be on treatment.
How does enzyme replacement therapy, or ERT, work to help slow down damage from Fabry disease?
Right now, we don't have anything that will completely stop it, but by starting treatment early, meaning taking the medicine at the times that it's supposed to be, you can certainly delay some of the complications.
Fabry disease is a deficiency in an enzyme called alpha-galactosidase that breaks down a substance called globotriacylceramide.
So what if we could give you some way to replace that missing factor? There are opportunities to do that in the form of enzyme replacement therapy.
It's an infusion that gives you a version of the enzyme that you're missing, and it helps slow that progression.
So just because we can't necessarily cure the disease, I'm going to say yet, the hope is we get better and better at things, and we do find a cure.
Even if your Fabry disease is considered mild right now, be sure to work closely with your doctor. Staying on top of your symptoms, making sure you're getting the tests you need on time, and taking your medication as prescribed can help keep your Fabry disease from getting worse.